Dr. Robert Goldman, pioneiro em longevidade e medicina esportiva.
The anti-aging marketplace is the fastest growing area of medicine today. What we do is we incorporate the latest technologies from internal medicine, plastic surgery, orthopedic neurosurgery, neuroendocrine medicine. We combine all the specialties together in order to perform medicine and medical care like it will be performed in the future. We take these technologies and integrate them in early on as early adopters. This is the fastest growing industry in the world today in the field of medicine. It's over $280 billion US internationally and growing at a rate of 8 to 10% per year. Why? It's because patients do not want to grow old like their parents did. The aging process and people are growing older and healthier. What you used to have is 200 years ago, average lifespan was about 25 years of age. About 100 years ago it was in the late 40s. Now it's in the mid-late 70s to early 80s. It's constantly increasing, so what we want to do is have a lifespan to where your peak health until the very end, then fall off, versus where it was, say, during the 1950s and 1960s, where there would be this gradual deterioration where somebody would be very ill and sick for the last years of their life. Now, if you used to go into the intensive care unit of the hospital, back, say, a generation ago, you had the rooms filled with patients in their 50s and 60s, where today, you don't see the people in the intensive care unit until their 80s or 90s. So you're getting people being healthier longer. But what we need to do is utilize these technologies. As we get older, our hormone levels drop. We need to modulate these. There are things we need to address, just like with women with menopause. We would give females various hormones to help to re-regulate them since their ovaries are no longer producing the hormones. Well, males develop something called andropause, and that's why certain males become very depressed. They develop something known as syndrome X, where their bellies get very rotund, they lose the muscle mass in their arms and their legs. So the men need to be regulated as well. What's kind of interesting is that the initial anti-aging patients were not women, as most people would think. They were actually men. Men were coming in because they were losing their hair, their sexual function was down, they were feeling tired, lethargic, that aggressive feeling they had when they were in business as a young person was waning and falling down. So the men were actually the first anti-aging patients looking to enhance their performance and their energy level and their capacity. Now, anti-aging medicine is really the next generation of sports medicine. And what do we do in sports medicine? We try to take somebody up to their peak level. If they're an Olympian or a world champion, we want to help them to set world records and to be a champion. Well, we use the latest technologies of training and weight training, resistance training, nutrition, dietary modification, various training techniques to make them a champion. What we need to do now is to now do this for patients of all ages, whether they're 70, 80, 90 years old. If they can only walk 4 blocks, we want to help them to walk 6 blocks. We want to try and enhance and treat each patient like an Olympian, giving them the best nutrition, the best medical care, if they need hormone replacement, if they need various other modalities, and to get them off of the large variety of medicines that they're on, their blood pressure medications, and they need sleepers to go to sleep at night, or other things to wake them up during the day. We want to get them on more natural things where we can, and we want to modify not only their behavior, but the way that they treat their own health. Today we're surrounded, and we're really engulfed in a toxic environment. The air is polluted, the water is polluted, the food has been distorted, you have genetically modified foods now. So you have this toxic environment that we're living in that is so much more dangerous than, say, 10, 20 years ago. Even the cell phones, we're surrounded by electromagnetic radiation. This didn't exist 20, 30 years ago, the way it does today. So we need to be even more careful, and that's why we need nutritional supplementation and other modifications in our diet and so on, because we're not getting the same healthy vitamin-enriched food now from the soil, because now the soil is depleted. So it's a completely different world we live in now, which is why we really need to make these modifications. So anti-aging medicine is not only the best way to practice medicine, but anti-aging medicine is the newest, most exciting field of medicine, because it is the way medicine will be practiced in the future by all physicians.